Well, let's bring in Dr. John Puntis, a retired consultant paediatrician and the co-chair of Keep Our NHS Public. What do you make of the figures?
Well, they're, I think, an appalling indictment of mismanagement of the NHS by this government. And, you know, A&E is a canary in the mine when it comes to the health service. So it's actually telling you about systemic problems throughout the service. And the Royal College of Emergency Medicine published similar data in 2021, where they estimated that around 300 to 500 patients a week were dying from delays in A&E. And what they're talking about is a patient who is seen in A&E and is judged sick enough to require inpatient care. But when that decision is made, they can't be transferred to a ward, usually because there's a lack of bed or there may be a lack of staff. And so instead of being able to start the ward-based treatment they need, they have to stay on A&E. And they've been able, using national data, to follow through what happens to those patients and look at how many of them have died after 30 days. And it was very clear that once you'd been in longer than 8 hours, your risk of death increased, and it was quite a lot higher by 12 hours. And that was entirely consistent with what had already been shown by research into delays in A&E, that mortality was increased by delays, and conversely, it was decreased by speeding up processes in A&E.
So it's a combination of factors which presumably makes it much harder to fix, because if it was just one thing, it could be addressed.
Yes, it's a combination of things. I mean, something like 17% of beds have got people who are well enough to go home, but there's no community support, social care support available, so they stay in hospital. We also, we've halved the number of hospital beds over the last 30 years, and in the last 14 years, we've decreased the number by 20,000. We now have high staff sickness rates, and that's related to 120,000 vacancies and people having to work extra hard, additional shifts and what have you. And all these things tie into why it's very difficult to fast-track patients through the system. So it's really a multi-system.
Yeah, Pat Cullen, the head of the Royal College of Nursing, earlier this week mentioned the need to invest in staff. I mean, is it just the case that there really aren't enough staff in A&E departments, or does this trickle down to GPs as well?
Well, I'm sure there aren't enough staff in A&E departments, but this isn't the reason for the delay. The reason is that there's nowhere for the sick patient to go, so beds have to be created. Bed occupancy now is usually running over 95%, and the maximum figure ideally is 85%, which gives wards flexibility when it comes to admitting patients. But we don't have enough beds, and we don't have enough staff, and we don't have a functioning social care system and community support system. Despite all the rhetoric about transferring care from hospital into the community, keeping people at home, the investment just doesn't go into the community. And I think government will, I'm sure they have done, attempt to say, oh, this is all down to the strikes. It's got nothing to do with the strikes. And the data from 2021 show that when the figures were very similar. Government really have to look carefully at the data and the methodology which the College of Emergency Medicine has used, and then say if they think it's wrong and why they think it's wrong, but not dismiss it because they don't recognise the data or because they're attributing it to the strikes. That's completely wrong.
I mean, ministers do say that they've made progress in reducing those waiting times. The government says that they're tackling it, and we have had other contributors this morning say that there has been some improvement. But from what you're saying, it sounds like that's just not enough.
Well, it's definitely not enough. I think the improvement is minimal. And what is government saying it wants to happen in the NHS? It wants to send more patients to the private sector, and it wants to make 4.5 billion cost savings through reducing the numbers of doctors and nurses. And this is just madness.
And, you know, without trying to make this a political thing, I'm sure you would prefer to stay out of that, John, but will Labour be able to make a difference to this? I mean, I know that Wales has a Labour government and they're suffering many of the same problems.
I mean, there are particular issues in Wales, given the Welsh population, older, sicker, for example, so a higher burden of demand in Wales. Labour could make a difference, but Labour need to look back at the new Labour era, and they will see that there was a very significant increase in investment in the NHS, and this reduced waiting times considerably and hugely improved satisfaction from patients with the NHS. So I think Labour will be in a position where they could improve things, but I think only if they're prepared to invest in the service. And again, they're talking about things like prevention, that's great, more community care and technological advances. But we hear these things all the time over the years. And without actually investing in hospitals, in infrastructure, in staff, in training, we're not going to see things improve.
John, we thank you very much indeed for your time. We appreciate your analysis here on LBC News. That is Dr. John Puntis joining us, the co-chair of Keep Our NHS Public. Thank you.